The first case of antibiotic-resistant bacteria was in 1962, but how did it start? First, it's important to know the difference between the bacteria and a virus. Bacteria are free-living cells that can live inside or outside a body, while viruses are a non-living molecule that needs a host to survive.
This growing problem is mostly caused by inappropriate prescribing and use of antibiotics. In some states, the number of prescribed antibiotic treatments per year exceeds the population, amounting to more than one treatment per person per year. Almost 30% to 60% of antibiotics are unnecessary.
When reproducing, genes can be transferred among related and non-related bacteria. This allows for antibiotic resistance to be transferred from any species of bacteria to another. This transfer of genes is known as horizontal gene transfer. However, resistance can still occur individually through mutation.
Carbapenems are B-lactam antibiotics which inhibit cellular division and formation of the cell wall. Resistance to carbapenems is caused by reduced carbapenem uptake and carbapenemase genes.
Carbapenems are similar to penicillins with the substitution of a carbon atom for a sulfur atom. This creates a double bond on the pentane ring, which creates a pentene ring. It is a heterobicyclic compound. The presence of the double bond with the pyrrolene ring allows for tautomerization with other molecules essential for amino acid and nucleic acid function. Between carbapenems, electrostatic, hydrogen bonding, and van der Waals interactions occur. These intermolecular interactions in carbapenems reveal that hydrogen bonding interactions enhance binding, stability, and efficacy of the molecule.
I have seen a case where antibiotic resistance has become a problem, usually in people with immune system problems or people that have taken antibiotics for every little thing they have. In the case that I'm talking about, it's a cancer patient who wind up getting an infection during his treatment, and every antibiotic they used was not effective on him. So therefore, he died from sepsis and not from the cancer itself. So I don't think that healthcare settings in general themselves are causing some of this resistance, but I do believe that people and patients that are going to see the doctor, they always want something. They want a pill. No matter what kind of problem they have, they want a pill. So they go in with a common cold and they want a Z-Pack, and that Z-Pack is not going to help them, or they want steroids, or they want some kind of antibiotic so it can fix the problem that they're having. And the issue is their body gets used to it, and that one antibiotic is not going to work anymore, so they have to use another one. The best prevention for antibiotic resistance would be having people learn to let their bodies fight off the infection before they go to the doctor and get a pill for every single little thing. Your body is a very wonderful thing, and it's made to always get back to a homeostasis, way to get back to normal for you as individuals. So we need to let our bodies do their job and stop taking antibiotics for every little thing. I think probably one of my biggest concerns for antibiotics in the future and for us is that our bodies become immune to the antibiotics that we have now. And as we start taking more and more, as they develop more and more, we keep taking them, and our body is just going to keep resisting them. It's going to build up a tolerance, and then all of a sudden, we're going to be without any ability to fight a regular bacterial infection. That is what they're used for, not a virus.
To prevent the spread, every individual should wash their hands thoroughly, learn the correct way to use and consume antibiotics, and do not reuse or share antibiotics. Use them exactly as prescribed. Because of interventions by hospital personnel, the number of deaths due to antibiotic-resistant infections have dropped by 18%. Luckily, research has shown a hopeful outcome of slowing down infection rates and resistant strain rates.